how it works for dermatology. We're going to start today by taking a look quickly at the patient portal, which is an integrated part of our system. This is not a third-party application. And what this allows a patient to do is to log in prior to coming into your office, and they can actually access information and answer questions for you. One of the most difficult parts of starting to use an EHR, meeting meaningful use guidelines for the government, is capturing all that data in a way that can be reportable. So this allows a patient to walk through a series of questions, be it about demographics, insurance information. Where it really becomes effective for a physician is that it allows them to go through and answer things like past medical history, social history, surgical history, family history, what pharmacy they go to. This portal allows a patient to enter information that's going to be populated directly into your system so that when a patient comes in, you don't have to spend your time entering past medical history information. Now, depending on your demographic, not every patient may do this, but even if you get 5 patients a day who go through this, that's 5 patients a day that you or your staff do not have to enter. It's part of the system and it comes with the system, so there's really no loss to it. As a patient walks through, the system just asks them a list of questions, and all of the values are alias text. So if we want to put things in layman's term for the patient, they can show here as things like fainting, but when the patient selects it, it will show in the medical record as syncope. All of this is customizable based on the practice's choice of what they want to enter and what they want to have available for the patients. This also will include things like allowing a patient to go through and create their own appointments, or allowing a patient to view clinical summaries, things that are options for a practice, as well as things that are required for the government meaningful use guidelines. So many of those guidelines have to do with giving patients access to their own information. This portal allows your patients to securely log in and get access to that information without it taking up any more of your staff's time. Now we're going to switch over to the electronic health record. First, we're going to walk through this from a clinical standpoint, and then we'll step back and take a look at scheduling and some of the other functions. Now, when someone first logs into the system, the first thing they come to is a dashboard, and this will show that user a summary of work that needs to be completed by them. So this will be things like my appointments, the patients who are checked in, what type of appointment they're here for, what room they're located in. And if I hover over any given appointment, it gives me more information, like what the appointment time was, what the check-in time was, so I can see more information about that particular account. You also have things like open visits. So any note, regardless of when the patient was at the office, any note that is not closed will appear here in open visits as work that still needs to be done. So you never have to worry about charts falling through the cracks or something not being completed, because it's notifying the user who needs to complete that work that they have work right here that needs to be completed. You'll have things like documents. So any document that gets sent to your queue, and a queue can be for one user or for many users. The documents queue allows any piece of paper that would typically be moved from desk to desk to desk is now done electronically through the documents queue. And what this does is this allows things like external lab results to come directly into the system. You can sign off on them, annotate these results. They automatically get filed under the ordering provider's name and under the patient's account. So without anyone having to do any work, this external report can come directly into my queue. I know that I need to work on this document. I can add my notes to it. I can use predefined annotation items, or I can type in something like everything looks good and move it to the next queue of the person who needs to take action on this. So the documents queue is a very powerful way of moving any document from user to user or group to group throughout the system. E-prescribing renewal requests come directly in from the pharmacy, so that as a physician, you get the renewal request, you can then automatically accept that renewal request, you can deny it, or you can deny and rewrite it. it's going to update that in the patient's account and send that request back to the pharmacy with whatever information you give them. And you have an internal messaging system so that when a patient calls up, the message will come directly into a queue for whoever needs to respond to it. They can review whatever the message is, add their own comments, reply to the person, and all of that's associated to this patient's account so that that patient's account has an updated record of every interaction your office has had with them, be it physically in the office or via phone conversation. Now we're going to jump right into a patient here and take a look at some of the different ways that we can view patient accounts and the information that gets populated by the EHR. There are many different ways of constructing this system, and each practice may have their own methods, their own definitions of different items, and we can configure this to fit almost any need. A patient's account has many different ways of viewing their information. One of them is a chart, and the chart is a very typical EHR method that will show you a list of items based on whoever I am as a user, the things that I want to see in the order I want to see them. So things like a list of the patient's problems, allergies, medications, past progress notes, prior visits that the patient's been here for. Now what we also have that's very unique is a visit view. And what a visit view does is it shows me a patient chronologically over time. So I can view all of their visits in a sequence and see what was done on any given day. I can see what the diagnosis was, what the procedure was, and even what my exam findings were from that particular day. This saves a lot of time from having to go back and look at individual visits and go from page to page to page to get a summary of a patient. Whenever a new visit is open, when a patient gets checked in, we automatically open this new visit and we open the patient's last visit. This allows you to quickly go into that patient's last visit, see what was done, and then if they're here for a follow-up of the same thing, you can choose to copy this previous note into today's visit. Now when you choose to do this copy visit forward, the system will ask you what aspects of this previous note do you want to copy. So you can choose to copy everything or pick and choose only the parts you want to include. Anything that's copied forward can be edited to or adjusted for today's particular visit. Follow-up visits become very quick depending on the type of visit it is because you can take that last note, instantly populate it into today's note, make any adjustments that you need to, and close out the note. And we're going to go into today's visit and look at some of the different ways that people use the system. First, we're going to do a cosmetic patient. When a patient comes in for a cosmetic problem, you can have a list of favorites or reasons that patients commonly come in to see you. So I can say that the patient is coming in for Botox today. This can open a particular template that has questions specific to this problem. What are the patient's goals for this particular reason they're here? Have they had this treatment before? When was the last time they had this treatment? Have they had recent sun exposure? And all of the values are customizable based on what any particular practice wants. Now I can go right to my examination in this particular type of setup, and this is going to have my pre-filled Botox treatment, whatever my template is. Now we have many different templates, and each practice may have their own way that they do this, but I've got this particular predefined procedure note that's going to populate. I can select my billing and my diagnosis from here. So I'm going to bill for one area, and it's under this diagnosis. And then I can also go in and actually do my drawing of where I'm applying the Botox. And you can change your ink color, and you can have that defaulted to different settings. And you can jot down notes on your tablet or touchscreen computer. So all of this information that I'm entering, it's just those two steps. I can now close out my note. My billing is done. My complete note is created with all the patient's history information, their physical examination or whatever the procedure note I did was, and the patient's assessment plan, which will all be sent directly over to billing, and those charges can then be applied to the patient's account. Now, if I return to my dashboard, what I want to take a look at now is a different type of visit. So I'm going to go into my second patient here. Again, I can go to things like my visit view and see more information. And this patient has had a few prior visits, so I can see what the diagnosis were of those visits. I can see what the procedures that were done were, the exam findings, anything in particular that was completed on that day. If I go into today's new visit, I have in this one a list of my cosmetic up top and my medical down below. Now, you don't have to use this method. People who want to point and click or like to dictate, you can use the system to do typing, dictating, using voice recognition. And one of the other options that's very unique to this system, and we saw it a little bit when we were doing the cosmetic note, but you can handwrite. And my handwriting's pretty poor, and I'm writing on a touchscreen computer. But this allows you, when you're seeing a patient, to jot down notes as quickly as you can write them. So as fast as the patient's coming in and out, you can jot down notes as fast as you can handwrite. You never get stuck in this system saying, where do I click or where do I type this information? Because no matter how many patients you've got, you can always jot down notes right on the screen. You can do a combination of these items, and you can do multiple items. So you can choose to do checkboxes, handwriting, typing, dictation, all on one patient, or you can use it for different patients. Or if you're someone who doesn't want to use one of the functions, we can remove that function as well. Now, something like a review of systems, we can default everything to normal. And you can have something like the skin section say, see the HPI, because that's where I entered my skin information. You also can work by exception. Say all systems are normal, go to the area where there's an abnormality, and make a selection. That's now going to produce sentence structure based on whatever verbiage the practice or the provider wants. So each provider within a practice can have their own specific verbiage. In this case, I have something that says patient offers no complaints of fevers, fatigues, chills, or significant change in weight. If one doctor wants it to say that and another wants it to say something completely different, we can adjust that in any way they want. As always, you can do that handwriting, and you can do typing or dictation. Now, patient histories. One of the benefits of an EHR is once the histories are in the system, they're always in the system. So now that I'm looking at this patient who's been here previously, I don't have to go through and re-enter any of this information. It's all already there in today's note with all of the information that's previously been entered. Now I can go through and make edits to this. I can say that I just reviewed it. You can do this in any sequence of ways, and this information typically gets entered by a scribe or front desk staff working off of an intake form, or if the patient completes it through the portal, and it will populate this information directly from there. Much of this information is required by the government meaningful use guidelines and must be entered in a way that we can report it, such as the smoking status. The examination, much like the review of systems, is fully customizable, and you can have it with predefined favorites of yours. So you can have things where I define what the patient's skin type is, and then things I commonly say can be quickly selected. I can have text boxes, dictation areas, or do handwriting as well. This can all be structured based on a specific problem. So a patient who comes in for acne can load a specific acne template. And in this case, I selected that the patient also was here for wart removal, so I can go to my specific template that's tied to doing that procedure. Now, for someone who wants to type or dictate, you can have a procedure note set up in a very basic way where it's structured to receive that typing or dictation. You can also do things like checkboxes and drop-downs. Say the number of lesions that the patient has, where are those located, what symptoms are they, what treatment was used. Go to the next area. Where are these located? what are the symptoms, what treatment was used. And you can use templates like this to validate the information that you're entering into the system. You can have post-treatment information. So the patient tolerated the procedure well. Here's my common text that I use. I can select any other findings or things I want to enter into it. And then I can even go in and do my billing. So the first pre-malignant lesion, I'm going to select a diagnosis for it, 2 through 14. And then I can even select the benign lesions and what was done for those. And all of this will tie into the billing. Again, you always have the ability to do drawings. So in this case, if I didn't want to do the face drawing, I can have a different image. And these images can be ones that you currently use today, but you can go through and create any image you want and have that be part of the system. You can jot your notes and make any annotations to the drawing that you want. Now the assessment for this patient is going to show me all the different problems this patient's been seen for previously. So if the patient is here for a follow-up of something, I can select which previous problems they're being seen for today. It's also going to already have those problems selected that I added from doing my particular examination and procedure. You always have the ability to add new problems to a patient's account. And when you go to add a new problem, it'll show you your favorites, and the favorites are customizable. And you can search within your favorites, and it will show you all the values. And then you can also search a database, which will show you additional ways of describing any particular problem. And if you want to add one of these problems into your favorites, you can do that by adding it to the favorites quickly from here. Now, once you have problems added to the patient, the system actually learns how the doctor treats problems. So in the past, for this diagnosis, here are the prescriptions I've written. Here are the procedures I've done, the instructions I've given the patient. If I switch my diagnosis, the system learns how I've treated this particular problem. So the patient had a diagnosis that they were here for a dressing change or suture removal. When I select that, it's automatically coming up saying, here's my suture removal procedure, and here's an instruction that I give the patient about that particular problem. I add that to my plan. When I go to my basal cell carcinoma, what are the different procedures and instructions I give? Well, I recommend the Mohs surgery. I may give the patient some medications and actually perform the procedure. So every day that a provider treats a problem, the system learns how they treat that problem. So the next time they see any patient with that particular problem, it's going to show them how they've treated it previously. If you stop prescribing a medication, it will drop out of the list. If you stop doing a procedure, it will drop out of the list. If you start doing something new, it will jump up and be added to that list. So it's constantly adapting to how each person treats problems. Now you can also do procedures and have separate procedure reports where I can go into this and say that here's my surgeon, here's my pre-op, and it's got a lot of this information already filled out based on what my preferences are. So what my description of the procedure was. I may have certain things that I select, no tumor was found. Select other values, my indications. I can enter any pre-op or post-op sizes, diagnosis. Enter any additional values. It's got my anesthetic, no complications, planned repair, what type I'm going to do. And again, because you have that ability to handwrite, you can always go in and have any drawing that works for you. So any way that you as a provider want to see a patient or document it, we can incorporate that drawing so that you can go right on the screen, make your annotations, your notes, and draw right on an image. Now, all of this is going to be sent to billing as well. So when I check off that I'm doing this particular problem, it's going to say, here's the diagnosis, here's the procedure, and it's going to send all of that information to billing. The system also is going to generate an E&M code based on what's selected. And as I go through and look at my E&M code, it's going to show me why I achieved that level. So my examination was comprehensive, my history was comprehensive, my medical decision-making was straightforward, and based on that, and this is a follow-up patient, it's going to recommend this diagnosis, or I'm sorry, this E&M code. I can always override this. So I can go through and select a different E&M code. And when I close this visit, it's going to send those charges directly into billing. Now, before I do that, let's take a look at one other note here. Take a look at an excision. And I'm creating quite the document for this patient. But when it comes to doing things like medical necessity, you can have notes that have very generic, simple to enter information that can either be defaulted, can be typed in, can be checkboxes, or any combination of those. You can have things like for particular lesions, instead of doing a drop-down and trying to select the locations for these, you can have text boxes, you can have radio buttons drop-downs. And you can describe the symptoms of that particular lesion that you're documenting so that you're getting your medical necessity for that. Again, all of this is customizable, and we have many different notes that we can provide that will allow someone to go through and find something that's going to work best for them, and then we can adjust it so that it fits their particular needs. As you see, I'm jumping from place to place throughout this. When we set up the system, each user will have their own configuration. So if I log in as an MA, I may only see the review of systems and history, and they go through and fill out that information. When you log in as a provider, you'd see that they're already checked off, and that information's been entered. You have things like consultation letters where we tell the system what aspects of this do we want to include. And do we want to include the patient's diagnosis? How do we want to format this? And we'll take a look at your existing consultation letters or any outgoing documentation that you have, and we'll replicate that as closely as possible with all the information that we're going to pull from the system. This can be faxed directly from here to the referring physician. So the moment that you've completed your note, that fax is already in their hand. Now also when you close a visit, the system can do a couple things. It can tell me that these procedures I selected and the diagnosis I chose, based on this patient's particular insurance, the diagnosis I picked is not a preferred diagnosis and may not get paid. So I now can look at these procedures that I ordered and say, based on this patient's particular insurance, do I want to choose some of these alternative diagnoses? So prior to it ever getting to billing, and billing having to go through and scrub it, the system can prompt that certain things aren't preferred by that patient's insurance. And when you close a visit, a number of things happen. One, it can check out the patient. It can create a document version of this so that billers have access to a document even if they don't have access to this particular system. And it also can notify me immediately of how I'm doing for those government meaningful use guidelines. So based on all the information I've filled out, based on the content that I've gone through and done, how am I doing? Well, I need to make sure that the staff is recording the demographics for that because we're really low on that. We need to make sure that we're capturing that information. I need to make sure that I'm sending more of my prescriptions electronically. And so without you waiting to the end of the 90-day reporting period, at the end of every visit, it can give you an update of how you did on that visit and how you're doing overall. So this is something that you can choose to turn on or off based on where you are with your meaningful use requirements. Now I'm back at my dashboard ready to see my next patient. If we go back and take a look at the patient that we were just seeing, one of the things that's unique about this system is it allows you to reopen a visit. So as I step out of the room, if I clicked on something that I didn't want to do, or I wanted to add in another procedure that was going to go to billing, I can then go back through and reopen that visit. This is a function that can be turned on or off based on the practice's criteria, but I can reopen this visit, go through, make edits to it, and then close it again, and it will update my billing charges. All of this is tracked within the audit log, but the document that's produced at the end of this doesn't show that it was reopened. You do have the ability to go through and add an addendum if you do not want to reopen the visit, but you do have the option, and the audit log will track everything that was changed when the visit was reopened. Now, within a patient's documents, you'll have all sorts of things like their lab results, progress notes that were created by the system. So as a patient is seen and the document is signed off on, you get a note that's created with any of the information that's been checked off, any information that's been entered, the procedure reports, any images that were drawn, all of that information is included. You also can have things like photos of particular problems that go right into the patient's documents. And again, these can all be annotated. You can add your own comments to them. You can move them from person to person. Now, as I mentioned, everything in here is customizable based on what my particular preferences are. And I'm going to adjust this on the fly here. We can go through and make the system completely customized for any particular doctor within the practice. So if I don't want to be doing the E&M calculations, the plan, the assessment, I just want to document my notes and be as fast as possible, I can remove all of those and make the system as simple as one option. So that when I go in to see a patient, all it has is my examination, and my examination can be customized, so that includes things like chief complaint, like review of systems. It just won't then do all the calculations for the government meaningful use, or E&M. But again, this is all based on where the particular provider is, what their goals are, and how you want the system to function. A couple other things about the system. You can do things like ticklers, and what ticklers do is this lets you say for a particular patient that I want to create a reminder based on this particular patient to myself, where I can say I want to remind myself in 2 weeks, this time is fine, to give the patient a call. And I can tell it to remind me or remind many people. And what happens in the end is you get this little flashlight bulb over here that pops on and off, letting you know that you have ticklers that are due to be reviewed. They can come as pop-ups to make sure that you see them, and they can just show up that here's all the information that I need to review and sign off on as far as reminders that were sent to me. This system will do things like phone encounters, where you can go through and document a phone encounter with a patient. I can send it to other people. And the system learns the things like the subjects that we type so that we don't have to keep typing out long things. It will present those to us in the future. And a phone encounter allows you to do things like renewing medications, where I can go through and say, I want to renew this medication for the patient. It's going to ask me, do I want to send this electronically, print it, or save it? And now this will renew that medication, add it in that patient's chart, and I've got this phone message as a record that I documented this with the patient, that I went through this with the particular patient. Patient pharmacies. The system will go through and allow you to find a patient's pharmacy very quickly because we default the patient's zip code. So it's going to show you those pharmacies that are directly or as close as possible to that patient's home, minimizing the frequency of time that you have to search for the correct CVS or the correct Walgreens. The system does all drug-drug, drug-allergy interactions. And you can do things like patient tracking, where you can see what patients are checked in, what room they're located in, and how long they've been there. Now, I mentioned that the billing goes directly to a queue, and what happens is, as a visit is closed, the charges that were created in that visit go to a queue to be reviewed by the biller. So the biller sees what the CPT codes were, what the diagnosis was, what the particular, if there are multiple diagnoses for a particular visit code. All of that information is present, and if the information is correct, they can generate the claim. They also have the ability to go into the electronic super bill and actually make edits to it if there's edits to be made. So they can add modifiers, they can add additional procedures. All that information is available here. Now, if I go to one more open visit, just want to touch base on the cosmetic one more time. Oh, and I'm going to change my system back to the way it was before. As you can see, this is all it takes to adjust the system. So it's something that can be done on the fly. The day that you decide you want to work in a different way, we can adjust the system. It takes almost no time whatsoever. A patient who's coming in for multiple things, you can select multiple different problems that a patient's coming in for. What's the one I'm thinking of? So as you select these problems, it's going to load all the different templates or procedure notes for these different items that are going to be completed. So here's my Ulthera treatment. I can put in my treatment site. I can select the bill codes for it. And I can do a specific drawing based on this particular problem. So you can have as many images as you want, do as many drawings as you want to be included in any particular note. So each particular type of cosmetic procedure that's being done can be added quickly into this patient's note with the billing selected as well. And you get a separate note for each item with everything that was completed in that visit. Now, last thing, I'm going to touch base on the schedule here. The schedule within this system allows you to open multiple schedules side by side. The schedule will show you all the information about your appointments, and you can set the schedule to include or exclude specific time slots. You can also set it that this doctor wants to allow 3 concurrent time slots, but don't allow a cosmetic visit and a medical visit at the same time. You can set all sorts of rules that can be applied to any particular schedule. The schedule will show you additional information about the appointments. It'll show you which appointment is overbooked. And tooltips show you additional information about any particular visit. You can go through and do things like checking eligibility, printing super bills, posting co-payments. All of that is built right into the schedule. And this schedule will go through and ties into all of the billing. So you can start running reports and saying, out of all the patients who were seen, checked in, checked out, how many didn't have procedure codes? I want to look at how many patients were no-shows. I want to look at what patients were canceled and what were the cancellation reasons. When you create appointments, you can track things like referral sources. So if the patient came in because of this friend of theirs, I can track that this is a person who is referring a lot of patients to me. So if I want to send them a thank you card, I can do that. You can have many different referral sources. It's all based on the practice and what items they want to have. You can track who the referring physician is. And enter any reminders about the appointment. Patients get checked in as easily as right-clicking and checking on them. And then what that does is that notifies the doctor immediately on their dashboard that this patient is here and ready to be seen. You can have things like those patient rooms I showed earlier, which track where a patient's located and how long they've been there. So again, the main point of this whole system in this demo is that we can adjust this system based on a particular provider's requirements. People can do that handwriting, they can do typing and dictation, they can do point and click. And when you do the point and click method, it can quickly load specific templates that meet your requirements. So when a patient comes in for acne, it can load my acne examination, which has certain things predefined. It's got my favorites, the things that I commonly describe acne as. It can have things automatically defaulted to normals so that I don't have to go through on every visit and check off those normals. So it's a combination of methods, and what we do is we customize the system to meet the practice's needs as best as possible. This will also allow you to do reports, so you can look at my patients and say, I want to see all of my patients who have a specific diagnosis who have not had an appointment within a specific period of time. You can start drilling down on information about your client base, and you can do things like bulk emails out to client base. And when you use that patient portal, you have patients who now can get reminders there. So if they're due for something, the patient portal can have that information present for them. There's many other things we could go through, but I'll leave it at that for now. And if you have questions, please feel free to contact us at any time. Thank you for your time.